Hello, my name is Liz and I'm one of the diabetes specialist nurses working as part of the West Hants Community Diabetes Service. This session is all about hypos. I'm sure a lot of you have experienced hypos since your diabetes diagnosis, and some of you may have had a lot or some of you may have just had a few. But most people with diabetes will tell us they don't like having hypos and will try and avoid hypos happening. So what is a hypo? You will probably have your own definition, but the International Hypoglycaemia Society defines hypos as hypo, meaning low, glyce, glucose, emia, blood. And basically a hypo is a low blood glucose level. An alert value is a plasma glucose of less than 3.9, but no lower than 3.5. Non-severe symptomatic hypoglycemia is when you'll have symptoms and then you can treat them yourself and your cognitive function is still intact. A severe symptomatic hypo is when your symptoms include cognitive impairment and requires help from another person, and if left could lead to a coma or seizure. Impaired awareness is the reduced ability to detect the onset of hypos while cognitive function is still intact. It can affect about 20 to 25% of people with type 1 diabetes and about 10% of people with insulin-treated type 2 diabetes. This usually occurs when somebody has repeated hypos, which can then lower the threshold when symptoms occur. The main symptoms of hypos that people with diabetes say they experience are feeling shaky, dizzy, sweaty, headachy, altered mood, and may feel ravenously hungry. And other people around them may notice pallor. Why then do these symptoms happen?
So the first time I had a hypo when I was at uni was probably on the dance floor. Yeah, one of the worst ones, I was around my friend's house.
I was quite scared.
I felt myself go a bit shaky.
My flatmates would be like, "Are you okay? Do I need to get you something?"
Kind of come out of nowhere as they sometimes do.
Luckily, I've got really, really good hypo awareness, so I would know like this if I was having a hypo.
So I thought, okay, maybe I should, test my blood sugar.
I'd never had to sort it out fully independently.
My friend would run around her house trying to find some sweets or Coke or some sugar or something. So I went off to the bar, tested my blood, I was hypo, and then pulled the diabetes card where you say to the bar person, could you give me some sugar please, because I kind of don't have any money and I'm hypo.
Obviously, my flatmates knew that it can affect my mood a little bit, so I might be a bit short-tempered, and they'd just be a bit like, okay, we'll just leave Emma to get on with it then.
The brain needs about 8% of glucose to fully function. So if the levels start to drop, symptoms start to happen. The sympathetic or autonomic nervous system causes adrenaline and cortisol to be released. And this causes the shakiness, the palpitations, the pallor. And these symptoms generally happen when your blood glucose level drops under 4 millimoles. At 3 millimoles, the neurological symptoms happen. The lack of concentration, the slurred speech, sometimes looking a bit drunk. Although unpleasant, the early symptoms are the early warning to something not being quite right. And this is when you should act on those symptoms and treat. We will talk about the treatments in the next video. So sometimes people will not pick up on the early symptoms. And if this happens, impaired hypo-awareness can occur. If we look at this diagram, you'll see that someone with impaired hypo-awareness will not actually develop those early warning symptoms until the blood glucose level is less than 3 millimoles. This can be a real problem for everyday life and for driving, and may actually prevent you driving. If you feel you have impaired hypo-awareness, please do talk to us, as there are things we can help you with. So, we've talked about hypos, but why do symptoms happen to somebody who has diabetes? When you don't have diabetes, if your glucose level drops, so does your insulin level, and the body then releases another hormone called glucagon, which converts your stored glucose in your liver and your muscles into glucose for energy, and so your levels rise. However, if you have type 1 diabetes or type 2 diabetes treated with insulin or a tablet called sulphonylurea, these medications won't stop working if your blood glucose level drops, and so the recovery needs help. So reasons that blood glucose levels can drop when somebody has diabetes is because you've had too much insulin, you've not eaten enough carbs, you've been more active than you anticipated. Sometimes in early pregnancy, women find that they have more hypos. Hot weather can make insulin work more quickly, and injection sites, so lumpy areas where you would normally inject. So let's recap. A hypo is when your blood glucose level drops under 4, and a severe hypo is when your blood glucose level drops under 3. Hypos can happen for a variety of reasons, and it's important that you know what your symptoms are. Although many symptoms are similar to somebody else with diabetes, it's really important to understand what your symptoms are. In the next video, we'll look at treatments for hypos, and then we'll talk about hypos and driving.